It is National Stroke Awareness Month, so what do you need to know in light of COVID-19? I am joined by Dr. Clinton Wright. He's the director of the Division of Clinical Research at the National Institute of Neurological Disorders and Stroke. Thank you for being with us.
It's a pleasure to be here.
What complications are you seeing with stroke patients and COVID-19 right now?
That's a very good question. Well, the biggest complication we're seeing so far is a dramatic reduction in the number of people that are seeking care for their strokes. We've seen almost between a 20 and 40% decrease at centers across the United States of people coming in. And that's very worrisome because, as most people know, time is brain when it comes to stroke. We want people to get in within a certain amount of time to be able to get life-saving therapy that can improve their outcomes. So that's a dramatic thing. But we are interested in some of the links we've been hearing about in the news about strokes in younger patients. Sometimes there's a concern that there may be blood clots forming or inflammation in the blood vessels that's affecting children. This is all early days. We don't really have a clear link yet, but we're trying to stimulate research in that area.
Yeah, a lot of unanswered questions, but one thing is clear, as we've reported many times, you said time is brain. So now more than ever, you want people to know, call 911 at the first sign of a stroke. But what would those first signs be? I think sometimes people think, I'm not sure what's happening.
That's right. And we have an easy acronym to remember, which is FAST, which stands for face. So you have face is droopy on one side. The A stands for arm. You can literally have someone lift up their arms, and if one arm is lower than the other and doesn't seem to lift up all the way, that could be a sign of stroke. The S stands for speech. So if you have slurred speech, or you have trouble getting the words out, or not understanding what somebody is trying to say where they normally would, and those symptoms all start very suddenly in a stroke. There's other stroke symptoms as well, such as balance trouble, sudden loss of vision in one eye, or double vision. And all of those things can be a sign of a stroke. And we want people to recognize that. And as you say, dial 911, get people in as quickly as possible.
Thank you. And we want to let people have this message. They're home right now. They can get some more information. We appreciate you being here. To learn more about the symptoms of stroke and treatments, you can head to stroke.nih.gov.
That's correct.
Thank you.
My pleasure.